My question is to the Minister for Health and Wellbeing. Can the Minister update my community on the recent incidents at the Pirie Regional Hospital? And with your leave and that of the House, I'll explain a bit further, sir.
Leave is sought. Is leave granted?
Thank you very much. Recently there have been reports of a young woman having serious results from a caesarean birth, and yesterday a security officer having safety concerns from an incident at the hospital.
The Minister for Health.
Thank you very much, Mr Speaker, and I thank the member for Stewart for his question and note his very strong interest in health in his electorate and obviously at the Pirie Hospital. It's obviously a hospital the government's investing significantly in and currently building a new emergency department to serve the community in. As the member has referred to, there has been reports in terms of a violent incident that occurred in that emergency department. The first thing to say is that any violence against healthcare workers is completely abhorrent and I hope is treated in terms of the full force of the law. And of course Parliament has passed special legislation enshrining that healthcare workers have a disproportionate protection in terms of the penalties that are imposed in terms of any assaults on those healthcare workers. Since coming to government, of course, we have extended security across a number of our hospitals, including Port Pirie, as well as additionally Wallaroo, Mount Barker, Mount Gambier, Berry, Murray Bridge, Port Lincoln hospitals, all now having additional security in place. In relation to the specific incident, I'm advised that there was a consumer was brought to the emergency department who was subsequently placed on an involuntary treatment order, an ITO. They were admitted to the ward whilst waiting for a transfer to an inpatient mental health unit, and a patient minder was allocated to the consumer located outside the consumer's room. The consumer left the room they were allocated to and became aggressive towards that patient minder. Security, medical, nursing and SAPOL attended the ward and assisted with restraining the consumer. This consumer was then reviewed by the doctor and psychiatrist and transfer was arranged by the RFDS to the Metropolitan Inpatient Mental Health Services. The staff member was provided with support by the York and Northern Local Health Network and the local management undertook necessary debriefs. Following the incident, the affected staff member and team members were debriefed, the incident was logged and the worker, I understand, has returned to work. So obviously we're very sorry that that occurred to that worker and we'd never want that to happen to any of our healthcare workers in our hospitals, and obviously that was completely abhorrent what happened. In relation to the second matter that the member raised in relation to a constituent, I understand, who's raised some concerns in relation to her birth. I've sought some advice from this in terms of the York and Northern Local Health Network. Firstly, we acknowledge in terms of concern that was a distressing birth that the consumer experienced, resulting in an emergency C-section and required a transfer to Adelaide for specialist care and further surgery. Welcoming a new baby into the world, of course, should be a time for celebration, and obviously we'd, very regrettable to have anybody have a difficult experience at that time. Port Pirie Hospital is a level 3 birthing service with a birthing suite serviced by general practice obstetricians and employed specialist obstetricians and midwifery group practice midwives who provide care and treatment before, during and after the childbirth. And should a patient experience complications and their condition deteriorates to the extent of beyond the safety threshold for that particular level 3 birthing service, then advice is sought from the tertiary centres in Adelaide that have a high capacity to provide that level of care. And as with any surgery, risks can occur when an emergency caesarean is performed, and these risks are explained, of course, before a surgery. I'm advised in this instance, treatment and recovery in Adelaide were clinically recommended, and of course the best course of action was to ensure the safety and well-being of both the mother and child. Of course, if the patient has any further concerns, we're very happy to talk to her and follow that up with the clinicians and make sure that we learn from the experience that she had to try to improve things for the future.